name's Haley. I'll be your nurse today. Can you tell me your name and date of birth, please?
Lauren Selman, and my date of birth is 11/24/2000.
Okay, thank you. I'm going to do an ear exam first, and then we're going to follow with nose and mouth, and then lungs exam at the last, okay?
Okay.
Okay, I'm going to ask you a few questions. Have you had any earaches or any pain in your ears before?
Yes, I had to have tubes in my ears twice.
Okay. When was that?
When I was 4 and when I was 6.
Okay. Have you had any pain lately, though?
No.
Okay. Have you had any trauma or head injuries?
No.
No? Okay. Have you had any ear infections?
Yes.
Now or were they in the past?
In the past.
How many ear infections have you had, you would say?
About 4.
When was your last ear infection?
When I was 8.
Okay. Have you had any discharge from your ears? Like water or anything like that? Like kind of like oily stuff coming from your ears?
Lately, no.
Okay. Have you experienced any hearing loss?
No, I have not.
Okay. I figured. Any loud noises at home or in your job? Like school?
No.
That would affect your hearing? Okay. Do you have any ringing or buzzing in your ears?
No.
Okay. Have you ever experienced vertigo or like a spinning kind of sensation?
No, I have not.
Okay. How do you clean your ears?
With a Q-tip.
Okay. Do you use ear protection from loud noises or while you're swimming?
Yes, I use earplugs while I swim.
Every time you swim?
Yep.
Okay. Now I'm going to inspect your ear and look inside of it for a second. So I'm going to look at it, make sure that the size is okay. Okay. My hands are probably a little cold. I'm going to just look inside it. Okay. Thank you. Okay. So now I'm going to ask you, if you've had any nasal drainage?
No.
You haven't had, like, sneezing or anything like that?
I've sneezed a couple of times today.
Okay. Do you have any, like, unusual or frequent or severe colds before?
Yes, about 2 weeks ago, I had a cold.
You did? Mm-hmm. Okay. Do you have any sinus pain with that?
No.
No. Have you had any injury or trauma to your nose before?
Yes. I broke my nose about 6 weeks ago.
Oh my goodness. So sorry. Have you had any nosebleeds with that?
No.
You haven't? Did your nose bleed at all when you broke your nose?
No, it did not. It just ran and ran.
Okay. Do you have any allergies?
Yes.
What are you allergic to?
Like the air outside, pollen.
Pollen and like hay. Do you have
Yes.
Okay. Do you have any changes in your sense of smell after you got your cold or like recently?
Like I couldn't smell when I had my cold.
Mm-hmm. So did it change the taste of food?
Mm-hmm.
Okay. So do you have any sores in your mouth or tongue?
No, I do not.
Okay. Do you have a sore throat anytime? Did
No.
you have a sore throat 2 weeks ago when you had your cold?
When I was sick, I did have a sore throat.
Was it more like hoarse or was it like scratchy?
Scratchy. Okay.
Do you have any bleeding gums?
No.
Or like you brush too hard and it bleeds sometimes? Have you experienced any of that?
Nope.
That's good. Have you had any voice changes? Like while you've like had your cold, has it like
Yes.
your voice has kind of like done that like awkward high pitch or low pitch kind of thing? Okay. Have you had any difficulty swallowing lately?
No.
That's good. Have you had any changes in your taste, like sense of taste? Obviously,
when I was
since
sick.
you're sick.
Yeah.
Not anymore though?
No.
That's good. Do you drink alcohol?
No.
Okay. Do you use nasal spray or use illicit drugs, like sniffing illicit drugs?
No.
Okay, good. Tell me about your dental care. How do you like your normal oral care every day?
I brush in the morning, then floss, then like use the little tongue thing to scratch your tongue and clean it, and then use mouthwash.
Okay, and you do that twice a day?
Yes.
Wow, most people don't floss, so that is impressive.
Yep.
Okay, so now I'm going to inspect your nose and see if you have any pressure there. Okay?
Alright.
I'm going to touch your forehead too. Does anything hurt right there?
Nope.
Any right there? Any pressure?
The first touch.
Yeah. The first touch right on your nose?
Yeah.
Okay. So now, Ardians, can I see your teeth and see if you have anything? Will you open your mouth for me? Well, looks good. Okay. Have you had any coughs lately?
No, I have not.
Just with your cold, you probably had a cough.
Just with my cold.
Have you experienced any shortness of breath?
When I was sick, like, since I didn't do any sports for about a week, once I got back, yes.
Was that, like, last week? It started,
like last week.
Like, whew. Yeah, that's normal. Have you had any chest pain with breathing?
No, except for when I was sick, like, my drainage was loosening up, so I could feel that.
Yeah. Have you had any past history of lung disease?
No.
Okay. Have you ever smoked a cigarette?
No, I have not.
Good. In any of your living or working conditions that have, like, affected your breathing?
Nope.
That's good. Okay. Have you ever taken a TB test? Tuberculosis, you probably haven't. Have you had a chest x-ray before?
Yes.
Yeah. When was that?
Like, around 7th grade.
Okay. When was your last flu vaccine?
This, like, November.
Okay. Now that we've gone through all that, I'm going to palpate your lungs, and then I'm going to listen for a little bit and do some percussion, okay?
Okay.
So I'm going to put my hands on the back right here. You're good. And can you say 99 for me twice, please?
99, 99.
Okay. Now I'm going to just do a few percussions. See if you have good lungs. Sounds good. Okay, now I'm going to listen to your lungs. I'm going to just have you deep breaths. I'm going to put it on your chest so it's easier. Okay. Will you breathe in for me? Good. Will you breathe in for me again? Good. Will you do it for me again? And one more. Okay, thank you so much.
Thank you.
That's the end of our exam.